Vanessa. I enjoyed Vanessa's description of CEOs as tortured and enigmatic. I think that was your phrase. It was good. It's much better than the fat cat CEO terms I'm hearing tossed around much more today. Let me talk a little bit about the perspective that we bring to the healthcare debate. First and foremost, I think that every executive leader that I talk to, and including myself, cares very much about the large number of unemployed individuals in this country, and we care very much about those who are uncovered in the insurance system. The sense of moral outrage among the business community is high. As an individual who went through a part of my life on public assistance, who went through years without having medical insurance, I just not only feel this moral outrage at a logical level, feel it emotionally, and can tell you that the CEOs of American companies care very much about an ability to close this gap and to fix it. Even more pragmatically, the concern over the cost and the threat to competitiveness from the extreme non-price value relationship that we have in the current system is a significant issue for us. We are at Kelly one of those companies where the cost of health care in our U.S. operations is actually higher than the profit we generate from those U.S. operations. And the cost of health care is rising dramatically faster than our ability to raise prices to our customers. And while many people in the media and in the political world focus more on the decision as to where companies may choose to shut down jobs and move jobs, I tell you that that is a very small decision compared to one as to where are we going to choose to grow jobs. And as CEO, I make the decision every year as to where are we going to put our investments. And people shouldn't be concerned about whether we're choosing to move 50 jobs from this country to that country. What they should be concerned about is that where am I choosing to try to grow 5, 10, 20,000 jobs? And increasingly the decision as to where are we going to try to grow our jobs is not in the United States, especially for a company where the cost of health care exceeds the profits that I generate from those U.S. operations. The only country in the 40 that we operate where that is so. And so the threat to the growth of jobs in this country, again, is not from us choosing to move jobs elsewhere. The threat is from us choosing to make the decision not to invest for job growth in this country. And that's a decision that hundreds of us are making every year, and healthcare is an important part of that decision. We at Kelly speak for an unrecognized part of the labor force that's not much part of this particular debate about the need for reform in the healthcare movement. We call it the free agent workforce. They include the self-employed professionals, the temporary employees, the independent contractors, the 1099s, the individuals who, as Lois was talking about, are making that choice to start that small business as an entity of one. This is a group of people that's 2.5 times the size of organized labor in this country. It represents about 23 to 25% of the U.S. workforce. Some of them do it and work in this style because it's the only way they can balance the needs of elder care and child care that they find themselves responsible for. Many do it because they have a dream of starting their own business, creating something new, doing that remarkable contribution to the American dream that we've all talked about, the ability to create something and to have it be successful in the marketplace. Those individuals are the most uncovered group of workers that we have. Those individuals don't exist in a collective fashion, so they have no organization speaking for them. And they are a group that we must consider as we go about our discussions as to how do we reform the healthcare system, the healthcare financing system in this country. I will echo what Lois said. Nobody should have to make the choice that they will run naked without insurance for 3 to 5 years in order to try to start a new business that has the possibility of creating creative edge for American enterprise, new jobs for the American enterprise, and yet we ask people in this country to do that all the time. There is a reason that the number of business startups in this country are falling, and falling as a proportion when you match it against percentage of people in the population to other industrialized countries. If you want to look at what is the threat to American competitiveness, not 1 year out, not 2 years out, But what will be the threat to American competitiveness 5 to 10 years out? It will be when thousands of people, tens of thousands of people, choose not to take a risk and start a new enterprise because of health care. It will be when hundreds of thousands of workers stay in a job where they are unproductive and unhappy because of health care. When we make those types of employment decisions, when we make those type of business risk decisions based on health care access, rather than on where could we make the most productive impact on our society, where do we have the greatest chance of reward, we have damaged one of the critical underpinnings of the free enterprise system. So as a business leader, I care much personally because of my own experiences that everyone have access to health care, but I care intensely also about the competitiveness of American enterprise in the long term, and we should care about the creation of jobs in the medium term because we are choosing to create our jobs elsewhere. And again, I would say we should be less concerned about where are we moving jobs and much more concerned about where are business leaders choosing to create jobs, because the United States is increasingly becoming a place we will choose not to create jobs because of the overwhelming impact of the cost of the healthcare system. Thank you all.